In an industry, in particular in healthcare, where all matters, we are called, we in particular in this room, I think, can make that difference, to transcend this idea of tribalism, to break the binds of us versus them, to ensure that if we do that well, we will find what is possible together. And I believe wholeheartedly that is our opportunity. That is this conversation of ripples of hope. And I believe it's how we move forward. You see, I've always said that I believe what we do in patient experience is about a movement. We are a group of people working together to advance the shared idea of changing healthcare. And that's the ride I hope you are on with us for these few days, the ride that you will stay on with us as we continue this journey together and continue to grow this conversation with one another. You see, each and every one of you are a tiny ripple of hope. Each and every one of you have the potential to be that tiny ripple of hope in any way, shape, or form you think is relevant and important to what you do. Those who disrupt their industries change consumer behavior. So we don't just have to react to what's happening, we can actually lead the change in which people engage in healthcare. They alter the economics, and ultimately, they transform lives. And this is Heather Simmons, she's a former Dell executive, but she talked about how they were able to disrupt the market and how they were able to transform lives. And, I've been fortunate, to travel the world this year, in the last year since we were last together, and be on 5 continents talking about this. And I was not too long ago in the Philippines. This is St. Luke's Medical Center, Quezon City, and I was walking on one of my rounds in a pediatrics unit. And, I was just looking at the work they were doing, and they were so excited to show me these pictures on the wall of how engaged their patients and families were in this process, how important it was for them to be part of this conversation overall. And as I looked, and I'm looking through all the pictures, they were incredibly moving, they were incredibly powerful. I came upon this one picture. And this picture was drawn by Kent. And if you read what he said, "Thank you for taking care of my little sister, Kendra. And also, thank you for accommodating me as a friend." This is not a parent. This is not somebody that understands the healthcare system. This was Kent, an 11-year-old big brother who was worried about his sister, and was able to acknowledge that you made a difference not only for her and her health, but for me in my life. And what he drew in all that thing, if you can see, all those little circles and heads were all the people. And when I was visiting the unit, they were so proud, they were pointing themselves out. That's me, that stick figure is me, and that's me, and that's me. See, it makes a difference. We are impacting lives each and every day. We are transforming lives because of the disruptions we're creating by pushing the ripples of human experience forward. People have flat out said, consumers, even though they don't know what maybe our definition is, they've told you what's important to them. To them, listening to me, treating me with courtesy and respect, helping me understand things, communicating to me in a way that I can understand is what's significant to them in making healthcare choices. And they're telling other people about it. The recommendations that people give me about where I should go is going to drive my healthcare choices. So the consumer ultimately has spoken here. I think when we look at what they're telling us, they believe experience is ultimately extremely important to them, that there are more similarities than differences across nations, across systems, and across generations, that they are affirming that interactions, the human-to-human, the personal interactions that we have are the most important thing that we can do in each and every day of our work. And that they're also saying of greatest importance that they feel connected with us as human beings. We are a global community. This is a global conversation. We are all, each and every one of us, those tiny ripples of hope. And that, I believe, and I hope you will hear from me, is the challenge. It is the opportunity.